I'm going to start recording now. And all right, here we go. So this is the legislative priorities training for Recovery Day on the Hill. If worse comes to worse, I may just turn my phone on really loud and have John talk to you that way. Not sure why he's having some difficulties there, but we'll keep posted on that. So I'm also going to put a link in the chat box here that is the presentation that we'll be going through today, which has some talking points and some bullets in it. And it's going to be a pretty formal, informal, I should say, conversation. And we will share this on MRC's website and also through our Facebook and social media platforms as well. So Recovery Day on the Hill, hopefully everyone is registered for that. We'll have a link at the end of the presentation. That's on March 9th. And I am now going to expose you to the 8 million tabs that are open on my screen and have everyone see our little presentation today. So, and where did the where did the present mode go? Oh, da, 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 da. All right. Boy, I think I haven't had enough coffee yet today. So
I see it in the upper right-hand corner, Wendy.
There it is. Thank you, Tiffany. Having a little senior moment here, trying to multitask to get John into the call. But anyway, so welcome everyone. We're really glad to have you here for our first legislative priorities training. And so this is a collaborative effort. Minnesota Recovery Connection historically has been the host of Recovery Day on the Hill. And we are a recovery community organization, which you'll learn a little bit more about later. We are collaborating this year with March, which represents mostly treatment providers in Minnesota. And we're really glad to have them as a partner this year. And so today, the session, your host today will be me and John Magnuson, if he is ever able to get into the Zoom meeting, but we'll make it work one way or the other. So the agenda, we're gonna give you a little bit of an overview of Recovery Day on the Hill. We're gonna talk briefly about how important it is to tell your story, give you a few tips on connecting with your elected officials, and then the bulk of the presentation is going through some policy highlights for the 21-22 biennial legislative session. And we hope to leave you with a few bullet points, a few talking points in some key areas. And we'll try to have some time at the end for some questions and answers. And everyone in this call, I'm sure, has a lot of different expertise, knowledge, and passion around recovery and various recovery issues. We want you to feel free to chime in. This is not intended to be an exclusive conversation, but we're just touching on a few highlights. One thing we really want to emphasize is that recovery is a process. It's a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And that's the definition that SAMHSA uses. And what I really like about that is it's a pretty big tent, and it's very inclusive, very person-centered. Really, recovery is about my individual improvement and health and wellness and my ability to fulfill that. When I say my, I mean each of us as an individual. I personally am a person in long-term recovery from substance use disorder. And in my recovery, that's enabled me to live up to my, mostly my full potential, and to be a productive citizen, to own a home, to hold down, a lot of different jobs, to really give back to my community. So we want to start with that framework of recovery as holding a lot of different things in it, and to really think about recovery as a continuum, that it's many different parts, it's ripples, it's waves. Often when we talk about recovery, especially in legislative spaces, it's easy to get focused on one particular part of that, like treatment or housing. And we want to acknowledge that there are many, many, many different aspects to recovery, and all of these are important. And if you're really passionate about a particular part of recovery, this is not, again, an exclusive list, that we encourage you to run with that and to, connect with your legislators on the issues that are particularly important to you. Just for the sake of focusing the conversation, this year we've really decided to hone in on 4 particular areas. One is recovery community organizations. Another is treatment providers, recovery residences, and recovery schools. So again, this is not exclusive. We encourage you to advocate where your passion is. There is great need in every area, but for the purposes of today, these are the 4 areas that we will be focusing on. So I am going to just check here. Make sure I haven't missed anything. Anyone seen John Magnuson yet? No? All right. Hopefully we'll get him in here soon. And maybe I'll call on, I think Amy's on the call, Amy Delwo. So when it comes to the March issues, Amy, I might give you a call out.
Hey, Wendy,
Yeah.
this is Deb Wamsley, and
Deb.
I'm texting with John and just sent a message to Amy about maybe we can step in and try and help out here.
Great, excellent. I just saw that text too, that you're here too, Deb. Great, so we've got it covered. So first, before we dive into the specific policy issues, we want to remind folks that it's so important to tell your story, no matter what that is. If you are personally someone in substance use disorder, in recovery from substance use disorder, if you are a professional working in the field, if you are a family member who's been affected by this in some way, the greatest power that we have as individuals to change policy, to change the status quo, is to leverage our own personal stories and make our voices heard. And a few key tips about that is, one is to make it personal. Instead of speaking, I'm specifically talking about when you engage with your elected officials. Nothing resonates more than when a constituent tells a personal story. And this adds credibility. It breaks down misconceptions. You're a real person in front of that elected official telling your story. You're not a number, you're not a figure, you're not a stereotype. This is you. And so that authenticity is incredibly impactful. The other thing that we really, really encourage you to do is to use non-stigmatizing person-first language. So instead of saying, I'm an addict, I'm an alcoholic, which we may use in private circles at times, but when we're speaking publicly, it's really important to make sure that how we're talking about the issues isn't misconstrued or confirming a stereotype with our public officials. So we recommend using person-first language. I am a person in long-term recovery. I'm a family member whose son, whose daughter, whose husband, whose wife, whose father, whose mother has been affected by substance use disorder. So humanizing, breaking those negative stereotypes. And then also thinking about how you're going to tell that story. How does the issue affect you personally, affect your family, your community? Give a specific example. And then what do you want to happen? Now just to illustrate this, I gave her fair warning yesterday, but I asked Tiffany Irvin if she would be willing to just do an example of how she tells her story and how effective that can be. So, Tiffany, oops.
Yes, ma'am.
Yes, ma'am. I'm going to stop my share here for a second so that folks can see you. Would you be willing to just share your story real quick here with us?
Sure. I'm having computer issues, so I gotta leave my camera off. I apologize.
No problem.
Okay, I'll keep it short and sweet here because some people know I can talk. I moved to Minnesota shortly after surviving an overdose, and I had just regained custody of my children. And after that, I knew I needed to change my life. I knew I needed to be sober. I knew something had to change in my environment. So I moved to Minnesota and I went to treatment. But for me, that wasn't enough. For me, treatment was kind of like putting a Band-Aid on a serious wound. And I knew I needed more than that to sustain my recovery. So I ended up finding a recovery community organization, Minnesota Recovery Connection. And I started volunteering there. It taught me some important things. It taught me that I wasn't flawed and that I could be okay in my own skin and that I could be okay with all the mistakes that I had made in my past. I think the biggest thing that it taught me was that I could use my mistakes that I made and I could help others, show them that they could have hope and they could turn their lives around. For me, recovery, like Wendy said earlier, it's a process, it's a lifetime. And while treatment taught me how to cope with the cravings, recovery was able to teach me how to live my life successfully. Now I have a healthy family, healthy relationships, wonderful kids, because I'm a wonderful mom now, amazing job. I have an amazing life now. And I think the most important thing is I realize that now I'm worth it and I'm worth living a life that's successful in recovery. Thank you.
Yay. Thank you so much, Tiffany. I think we can all do a clap emoji there. So does anyone else want to take a crack at, if you were in front of a legislator, like how you might tell your story real briefly?
Were you talking to me?
I am, Meg.
Oh. It caught me off guard.
I thought you're good at doing things on the fly, so I'm glad you caught the hint there.
Yes. Oh, I came into recovery for the first time when I was 45 years old after my son died. And I was filled with pain and I was filled with anger. And I just really wasn't sure that I wanted to live. But what I found out is that my addiction was making that feeling of worthlessness and less than magnified. And I figured that out when I was volunteering at Minnesota Recovery down when they were at in St. Paul. And what I learned there is like Tiffany was saying, I learned that I wasn't flawed. I also learned that even though I was struggling, people there still loved me. And my addiction has really tried to run my life for a very long time. And So I really struggled in and out of crises would come in my life, and I would go back to what I knew. And there was one thing that when I finally began to have string some clean time together, it was that I knew that I needed people outside of treatment. I needed people that could love me, even though I didn't want to be loved. I needed people to just encourage me and let me know that you got this, Meg. And that support, which today is called peer recovery support, back then it was called Minnesota Recovery Connection. And the people that I met there, but that lifted me up enough that I started having crises, and I was able to stay clean. And I also learned that it felt wonderful to give back, even though I still couldn't accept love or friendship. I could give it back, and that felt good. That felt good in my soul. And I continued to grow. And one thing that I would, I'm 60-some years old now. I don't feel it, but I am. I was 61 years old when I learned what a friend was. For the first time in my life, I have a friend. And that came with my recovery. Thanks.
Oh my gosh, thank you, Meg. Thank you so much. That was beautiful. Oh, thank you. So powerful. I'm so proud of you and so happy for you. Just amazing. I almost feel like we need to take a break now, but I know that there are some others who would like to share their stories right now. I think we're going to come back to that at the end, just to make sure that we can get everyone in here. So I'm going to go back to sharing my screen here. And thank you, Megan. Thank you, Tiffany, so much for sharing your stories there. Oh my goodness. You can't see my screen, can you? Here we go. There we go. You all are immensely patient. All right. Wow. So both of those really knocked it out of the park. And thank you so much to both Meg and Tiffany for being vulnerable with us and being authentic and sharing their stories. And that is such a powerful testament to something that was really important to both of them, recovery community organizations. And I think no matter what your issue is, being able to find that personal connection and to tell that story is incredibly powerful with elected officials. And it's a little bit about what we want to touch on next, is connecting with your government representatives. So here's John, who has yet to be on the call. Deb and Amy will be speaking on his behalf, along with Senator Eaton and Senator Bobby Joe Champion. So just a few quick things about connecting with your elected officials. It's so important to leverage your voice as a constituent. Elected officials are very responsive to constituent concerns. So if you're not sure who your state representative or state senator is, I've added a link here in the presentation to a tool that's really easy to use. You just type in your address and it will tell you who represents you. and give you links to how to contact them. You know, during the era of COVID-19, it is more difficult to meet with people one-to-one, although many reps and senators are taking constituent meetings via Zoom. We have found that if you email your constituent, that if you put constituent in the headline of your email and then you add your zip code afterwards, that's going to help elevate your email to their attention. Legislators are extremely responsive to constituent concerns. They get a lot of emails, however. So if someone isn't your representative, they're probably less likely to respond to you. So we'll come back to this at the end after we've gone through some of the policy issues and just kind of practice how we might connect with our represented officials. But the main point that we wanted to make here is that your voice as a constituent is very powerful, and don't be afraid to reach out. Write a personal note, tell your story, and ask for something. You know, what do you want to see changed in the system? We're in the first year of a biennium. So the Minnesota legislature operates on 2-year cycles. And so some of the policies that we're going to go into next are things that are probably going to be relevant over the course of the next 2 years. And so when we talk about really important issues, to know that sometimes it takes a long time to get those enacted. And the session that we're in right now is the 21-22 biennial session. So we'll come back to that. And I want to make sure we have enough time to go through some specific policy issues. Look at the power in that photograph of all these people in recovery or recovery allies or family recovery on the steps of the Minnesota State Capitol. So this was from the Walk for Recovery 2 years ago. I think that, you know, we should just make postcards of this and have everyone carry it around and bring it to their elected officials. Our voices have power, and look at the joy and the strength in the numbers on the steps there. I think that's a great inspiration for some of the specific things that we'll talk about here. So the first area that we'll touch on is recovery community organizations. And just a little background, recovery community organizations are non-clinical. They're community-based nonprofits that are led and governed by members of the recovery community. And the gist of what they do is provide free services, free peer recovery support services that are delivered by people with that lived experience of substance use disorder and recovery. And it includes one-to-one coaching, telephone support, providing social hubs for people to make new networks with recovery supportive systems, opportunities to volunteer and give back. Recovery community organizations honor all pathways to recovery. They're person-centered, strengths-based, and really a lot of what RCOs do also is resource navigation, helping people connect to the resources they need at that time, no matter what that is, and make really assertive linkages to recovery supports like housing, employment, sometimes even treatment, other social services. And they do a lot of public education and advocacy and community outreach. And a quick way to think about recovery community organizations is that they're one-stop shops for recovery that fill gaps. They're kind of like department stores for recovery. No matter where you are in your recovery journey, if you go shopping in an RCO, you're likely to find someone or something that can help you take that next step forward to what you need. So the key issues for the 21-22 session around recovery community organizations, a big one is that we're really lacking in RCOs in Minnesota and community-based recovery support. Accessible, ongoing recovery support services are not that prevalent. We have 415 licensed treatment providers, but we only have 10 RCOs. Most of those are concentrated in the Twin Cities. There's whole gaps in Minnesota, like the whole western half of Minnesota, where there are no RCOs. And most of the RCOs that are in existence are very small. They lack stable funding. They're almost, I mean, they're always projects of love and passion, where the founders and the workers are doing this because it is critical for their communities, and it's an act of passion. And most of the free services that RCOs provide are not reimbursable through Medicaid. So there are some state systems that allow for peer recovery support to be reimbursed through Medicaid, but it's pretty narrow, the number of services that can happen through. So a real key issue for RCOs is just, do we have enough of them, and can we sustain the ones that we have? And at the end of the day, RCOs and peer recovery support services, they save lives, they improve recovery outcomes, and they reduce costs. And a really important statistic to remember is that stable recovery, for example, from alcohol, it's not reached until you have 4 to 5 years of sustained remission, and that can be longer for other substances. So we're going to go next into some issues around treatment and how to strengthen our treatment system. In addition to treatment, it's really critical that we have ongoing recovery support. You know, treatment's kind of like the emergency department, or it's an intervention that helps to stabilize you, helps to correct, helps to get you going on the right direction. We need services in addition to that help to sustain individuals to get to that benchmark of 4 to 5 years of sustained remission. So a few talking points. We heard some great stories earlier from Meg and Tiffany about recovery community organizations. One talking point, we do have a bill in the legislature right now that is to provide funding for RCO infrastructure. This is really to help build the network of Minnesota's recovery community organizations to help sustain them in ways that help provide funding for things that are not otherwise reimbursable. And so Representative Sydney Jordan is the chief author of this bill. It's still in the revisor's office, and so we hope to have a number attached to that very soon. And once we get that number, we'll share it with all of you, and start advocating on behalf of that legislation. The other thing that we really ask for people is that you advocate for putting recovery into all legislation. This is an easy ask. So most legislation, you'll see prevention and treatment called out, but it's not as common that you see recovery. And we really want to advocate that you need all three: prevention, treatment, and recovery. So making sure that there's legislation that specifically mentions items such as recovery, peer recovery support services, community-based recovery support, RCOs, or that representatives from the recovery community are included in processes. A really good example is the recent legislation to legalize cannabis. Now, if you look through it, there are some opportunities in there to take revenue to support prevention and treatment. We want to see recovery added to that as well. There's an advisory board that would be created from that. We want to see that a representative from a recovery community organization is added to that bill. And overall, really holding the state accountable for a recovery-oriented system of care. How is the state supporting individuals throughout the recovery process? So those are a few talking points around RCOs. I'm going really fast because we got a lot to cover here. So I am going to turn, and again, you'll have this slide deck so you can take these bullet points with you. I'm going to turn it over to Amy and Deb and see if they can provide a little background around March's priorities for the legislative session.
Certainly. I'll start. I can't see Deb, so I'll just speak out here.
I'm here.
Okay, excellent.
Okay, here we
So,
go.
okay. So March, it has a pretty big tent. Not only are we inclusive of treatment providers, but also other professionals that are supporting recovery, as well as prevention and clinical staff, et cetera. And so in essence, what we're looking to do is assure that people have access to substance use disorder treatment, co-occurring mental health services, that treatment is individualized in terms of a person-centeredness, as well as evidence-based, and that there is a full behavioral health continuum. So similarly to what Wendy's been identifying here, that we're wanting to see that not only is there prevention, treatment, but long-term recovery. And we think that there's a gap in that currently. So we identified kind of three main pillars in terms of how we feel like we will be able to effectuate this into the future. First is assuring that there's access across the state. And right now, there's only 1 in 10 who are in need of treatment, who are receiving treatment. And we want to make that at least 3 in 10, if not 10 in 10 into our future. There are workforce shortages across the state when you think about LADCs, particularly as well, individuals who are people of color or BIPOC communities, that we need a more diverse workforce, that there is challenges with retention, and that we are also trying out different modalities in terms of technology to help shore up some of the workforce shortages that we're experiencing. And so the third pillar is around sustainability. And something that we've been looking at there is how do we improve our quality, but also at the same time that we have the resources necessary to undergird that and propel quality forward. And some of that happens within the rates. And so next slide. The governor's budget, as it was presented in February, makes some fairly dynamic shifts to the substance use disorder reform work that had been going on from a couple years ago. The lead up to what is affectionately called the 1115 waiver demonstration, in essence, is trying to move forward quality, the ASAM criteria that you saw on the other slide. And in essence, the federal government is providing a enhanced match when we get providers into this demonstration. It was intended to be a voluntary enrollment, but the recent governor's budget mandates that for residential providers. In addition to that, you'll want to back up. I'm not quite off that slide yet. Oops, I think you went forward. But in essence, there's a couple other things that the governor's budget does. It eliminates the medical complexities. So that's for rate enhancements that are received. So enhancements for co-occurring, enhancement for a medical complexity, women and children in treatment centers, as well as culturally specific programs. And so those are something that we want to retain in place. It also imposes some caps on the number of hours that outpatient programs can administer to for treatment. So in essence, March came up with a set of alternatives, and briefly, we're wanting to assure that that providers are supported through the mandatory enrollment process, and that is phased in over time so that they're prepared to do that successfully. We want to put a hold on the elimination of the enhanced rates, which you see above 1, 2, 3, and 4, and actually look at a comprehensive rate restructuring that assures that we've been able to contemporize that rate structure going forward. Also putting into place some support for providers, particularly rural providers and small providers, so that they can get increase that quality and also have the referral chains required for the 1115 demonstration. And then also we've talked about building out that continuum. And one of the pieces of that continuum is building out the RCOs, as well as initiating school-linked substance use disorder grants. Next slide. There's a couple other bills that March has initiated. One has to do with telehealth. Telehealth has been a lifesaver during the COVID environment, allowing people to continue to receive treatment. And so we want to maintain those flexibilities and waivers that were extended during the COVID period longer term. What we found is that when we're able to use this tool flexibly, such as in a hybrid environment, we are seeing actually better outcomes for our clients when they're able to attend to other treatment, other appointments, such as a healthcare appointment, et cetera. But also it cuts down on the concern about travel and so on. So supporting Senator Rosen and Representative Morrison's bill, those bills embed what March is seeking in that area. We also are seeking that the letter of need, whenever a treatment facility is going to open a program in a county, they need to submit a letter of need, and it requires some homework, if you will, on several different spots. And our opinion in this regard is that because there's 1 in 10 people who need access to treatment receiving it, that there is a demonstrated need, and that this letter of need and this work is not necessary. We have negotiated with the counties that we would be would provide them with notice prior to opening a program or submitting our application. And this gives them an opportunity to engage with the provider and have a formalized discussion. Next slide. We are also seeking regulatory reform, and that is in the alternative package that we put forward in response to the governor's budget. In essence here, what we're looking at doing is, this has been an additive process over the years in terms of regulations that the substance use disorder treatment providers are responsible for. And so we want to take a look at that and streamline that to contemporize it with where we're going forward. And Wendy had made mention about the excise tax on cannabis. And what we were seeking here is an amendment that assures that a portion of any excise tax going forward is inclusive of prevention, pregnant and parenting women, and treatment and recovery. And we expect that that should be the same for any addiction-related good, such as alcohol, tobacco, and gambling. Did we reach the end of the slides? Oh, Deb, I see you on my screen now. I don't know if you want to do this slide as our president in terms of the talking points, or if you want me to plow ahead.
I'm happy to jump in. So what we're asking for is that, first of all, we're reaching out to representatives, and we would encourage you to do so as well, to oppose the governor's proposed budget as presented, and that we support March's alternative solutions, which engages DHS and commissioners and the legislature in creating some alternatives to the governor's budget proposal. Again, we want to support the continuation of substance use telehealth services. One of the areas that we're focused on, again, specifically, is not just the telehealth. We found that there are some real benefits to using that, but also including telephonic services. Again, this reaches communities of color and also rural communities in a way that we have not been able to do in the past, supporting the removal of the letter of need and like barriers to access for agencies looking to open up new programs, supporting paperwork reduction so that more time can be spent between clinicians and the people that they're working to support and serve, and other barriers to access, or other systems improvements, I'm sorry. And then supporting the allocation of excise tax from cannabis through a block grant model to the entire recovery community. Next.
Great. Thank you so much, Deb and Amy. We have a few slides here. No one from MASH was able to participate today, but these are their slides. Amy, you had mentioned you were working with MASH. Did you want to go through?
Yeah, I'm familiar with the work that they have had going, so I'm happy to jump in here if you want me to.
Sure.
Okay. So a recovery residence, generally there's 4 different levels of recovery residence. The predominant level in the state of Minnesota is one where it's a peer run home. And in essence, there is a house kind of manager or leader, if you will. Generally, there are anywhere from 10 to perhaps 14 people in a home. They will usually share a room, 2 to a room, sometimes in terms of the size, maybe there's 3 to a room. But the goal is that people are working a recovery program together and supporting each other. And usually these are individuals that are newly in recovery. Sometimes they're actually receiving treatment or newly have been discharged from treatment and are looking to kind of gain a foothold in the community. And so, so recovery residents are, again, another important part of that continuum of recovery. And so you'll be in a home with individuals that are at all different stages. So let's maybe go to the next slide. There was a bill that was introduced this year, Senate File 873, in which it's encouraging a study of the sober homes in the state of Minnesota. In essence, it wants to look at how to improve access, whether or not these homes should be regulated in some way or some oversight. Currently, they're not licensed. In essence, they were built on or predicated on the fact that it's it runs like a family home with individuals in the home, and it's meant to be family-like. And so it's recently captured the attention of some in the legislative venue. Now, MASH, Minnesota Association of Sober Homes, actually is what is a state affiliate of the National Alliance of Recovery Residences and the National Council for Behavioral Health. And in essence, there has been a deep practice over the last 5 to 7 years where they've been working on standards that can be uniform across the country. And so they have some things in terms of, or MASH is bringing forward an amendment to the study to say, here's the definition for Minnesota in terms of what recovery housing is, establishing a registry of sober homes, because it's not really known how many are across the state. Many are known, about 100 of some of them are known or so, but not all of them. That the state will provide a technical assistance and financial assistance to the Minnesota affiliate to support sober homes in improving quality and standards, and that they assure that programs with state funding refer to properly accredited recovery residences. And so in essence, what they're looking at is any treatment provider or another provider that may be receiving funding through Medicaid or some other general fund, state funds, that if they're going to refer to a recovery residence, that that recovery residence needs to be accredited. So that's their bill. So they're opposing right now the Senate bill as it stands. They're seeking for their amendment to be accepted. Let's see, ask for the state to support. So in essence, they want you to, request that you support the MASH mission to uphold high standards. Sober homes have grown organically as the community. And so what they would like to do is continue that organic growth, if you will, but also mature into these improved standards that they've been working on with the national affiliate. And then in essence, supporting the accreditation processes, similar to what you might see in an Oxford house or a MASH house. I think that might be the last slide.
That's it. Thank you, Amy, so much for representing MASH there.
Certainly.
Really appreciate it. Just real quickly, also, we weren't able to have a representative from the recovery schools here today. Michael Derschlag sends his regrets. But real quickly, what are recovery schools? They're secondary schools that are designed specifically for students in recovery from substance use disorder or co-occurring disorders. And they essentially provide a safe, sober community based on recovery principles, and give students that opportunity to have a new start in an environment that really meets their unique needs. And they're especially effective in promoting pathways to higher education and moving right into collegiate recovery programs, which can help get someone to that benchmark of 4 to 5 years of sustained recovery, being in a really supportive recovery environment. And just a real quick note, Pease Academy is the oldest recovery high school in the United States. And so some of their key issues is obviously students with substance use disorders struggle in traditional school environments. Minnesota has 6 recovery school programs right now, but those numbers have been declining over time due to inconsistent funding support and a number of other reasons. They're a strong investment in the future, that they really prevent long-term substance use disorder issues. Most individuals who have substance use disorders as adults have started use in their teens. And so they're a good preventative support service as well. And there's some really a lot of emerging research about the effectiveness of recovery schools, and also about the ineffectiveness of when you return a student who's received treatment back to the school environment that they were in before. About 98% of those students will return to use. So the traditional school system is not very supportive for students who have substance use disorders. And so just a few quick talking points for the recovery schools. Their basic issue is they really are advocating for the renewal of the recovery program grants, which is a grant program through the Minnesota Department of Education, which provides funding support to recovery schools. And so it's not a given that that would be renewed. So that's their top priority. And also just to speak on behalf of the importance of having these recovery-friendly environments for Minnesota's youth.
Can I add something to that, Wendy, real quick?
Yeah, absolutely.
Part of as we think about this, I think about recovery and the needs of the recovery community as kind of an umbrella. And oftentimes in recovery, the folks that are working within the recovery community and are in recovery ourselves are battling either stigma or invisibility. Mm-hmm. And we really want to think about the commitment to recovery as a longitudinal system of care and support. And so rather than looking at just treatment, like Wendy mentioned earlier, which tends to move us more towards an acute care model where you go in, you get care, you get moved on, and it gets seen as either success or failure. We really want to take a look at recovery and the recovery community as longitudinal in nature, that we need supports that continue throughout a person's life experiences with recovery and during those times where a person might stumble, that it's not seen as a failure, but that there are supports in place that will continue to help fortify us.
Thank you, Deb. I don't think anyone could have articulated that better than you just did. So that's exactly the key issue. And I think one of the reasons we touched on these 4 aspects of the continuum, from recovery schools for youth to treatment, having a recovery supportive place to live, and then having that ongoing community-based recovery support that RCOs provide. You'll hear more about all of these issues at Recovery Day on the Hill, where representatives from these organizations will be speaking, along with legislators who are supportive of these issues and community members who can speak firsthand to some of these issues. And I'm gonna stop sharing there and open up. We're right at 1 hour. We had a few glitches when we first started, but I wanna save some time for just some conversation. If anyone needs to leave, we totally understand because we're at the hour now, but let's open it up for some questions and conversation for those who would like to stay. And again, we've recorded this, and so we'll be sending it to everyone who registered, along with, there's a lot of questions in the chat that we will try to answer as well. So does anyone want to chime in, or any of our speakers? Just really want to thank Deb and Amy for jumping in today.
Absolutely. You know, I just as, you know, to kind of step into the idea of reaching out to our legislators, I just sent a couple of emails out yesterday to my representatives. And one of them, I was able to send just a regular email, which included some links related to these issues that we've been talking about today. And the other one didn't allow me to do that. I had to go in through their site and put in my name and then type in what I wanted to do or what I wanted to say. It can be scary to think about reaching out to them, but the thing to remember is that the majority, I mean, substance use and mental health concerns affect every single one of us in one way or another, whether it's directly or whether it's through someone that we love. And the same is true for our representatives. And that's how we reach out to them and make connections with them, because they're people, and they're going to be listening to us and our concerns. And on some level, it probably touches them too.
Yeah, absolutely. I think that's the biggest takeaway, is your representatives are other human beings with lives and problems and family members, and most of them have been touched by these same issues too. So our voices really help to amplify that and to put that into policies that are supportive of a recovery continuum. I think that's the message that keeps coming through today, is we need a big umbrella, and it's more than random services here and there. It's everything. Anyone else want to just jump in or have a comment or question? We got a lot of comments about people who've had supportive experiences in sober houses. That's great. Rick just asked, can someone explain what is bad about applying the 1115 demonstration project standards? You're getting us into the weeds there, Rick.
So it's not that the 1115 demonstration project itself. I mean, the plan for the 1115 demonstration project, in terms of what it brings about, in terms of standards and criteria, they're great standards. What part of the issue is the timeline and the financial resources that are being tossed out in lieu of bringing in this new demonstration project and expanding it to everyone. So it's not so much about what is in the content of the 1115 as much as the structures around it. Amy, you may want to jump in if you're still here.
Yeah, I think in essence, there's a lot of work that goes into improving or getting up to those standards. And so you have to have the infrastructure in your business to hire certain professionals. So you need to have access to licensed nurses. You need to have access to mental health professionals and so on, and a certain number of those, as well as assuring that you have memorandums of understanding along from everything from a detox center, a hospital, all the way down to peer recovery support. And so, so that is challenging. And there are several who have enrolled already. And this is something that March was pushing and encouraging the state to do, but it was on a voluntary basis. And they flipped that up and are now giving the providers who did not contemplate enrolling less than 2 months to prepare and to execute that kind of business shift. And so that is what's of concern, is the approach of how they're going forward, and then concurrently extracting resources from those businesses that have already invested and hired these people, and then trying to figure out how they're going to sustain that in their business.
And it's concerning in general for, other agencies, but also when you think rurally, I mean, for rural agencies that have perhaps fewer community resources to put together those added elements that need to be in place. It requires time and financial resources.
Great. Thanks, Deb and Amy. Shelley had a question about, when writing to our legislative representatives, do I appeal to the funding needed as a person in recovery or as a person that works in the field and knows what will happen if adequate funding is not available? I would say yes. Tell your story. And I think it's important that you are coming as yourself, and just make it clear, depending on the organization that you work for, that you're not representing that organization, you're representing yourself as unless you've been empowered to do that or told to do that. But most importantly, come as yourself. You work as a professional in the field, you're a person in recovery, and you know firsthand that the funding is needed. So that's a great question, Shelley. You should never be afraid to speak as yourself. Great. So we have gone over here. Any other last questions or comments? There's been a request for contact information. So this presentation is a live Google document. So I will add contact information. Is it, Deb and Amy, is it okay if I put you in there as well? Great.
Absolutely.
And I'll put some contacts in there for MASH and for the recovery schools as well. So when you go back into this document, the contacts will be in there. And then since you've all registered for this, I will send the recording and the slide deck to you again, so you can have this to share. Well, this was our first attempt at a legislative priorities training, and we hope that we touched on a few important issues for you, gave you some talking points. And the big takeaway is, don't be afraid to contact your legislator, speak to them as their constituent, and tell your personal story. That's really important. And make an ask. What do you want to see changed? We gave you some really specific bullet points to go for. All right.
Thanks, everyone.
All right. Thank
Stay
you,
safe
everyone.
out there.
Bye-bye. All right.